Hi doctor friends, welcome to my YouTube channel PG Doctors INDRANJU. Today's topic is very important topic and most repeated topic in the AIIMS PG, NEET PG and DNB and all other types of medical PG. So this is very important topic and most repeated topic. So watch till last so that you can't miss any one question. Let us start without wasting of the time. Anatomy one-liner part first. The first is the muscles that is anatomically a back muscles but functionally related to thorax. It is Latissimus dorsi. The image showing you the muscles which are given that it is the Latissimus dorsi. This is the muscles showing you that it is the Latissimus dorsi. Okay. Next thing is that the medial most in the femoral triangle is the lymphatics. I have already uploaded the video regarding the femoral triangle. The image of the femoral triangle, already you know that the femoral triangle, this is the femoral triangle showing you like that, and in the medial most part it is the femoral sheath, and in the femoral sheath this is the medial most part, and the medial most part this is the lymphatics of the femoral triangle. Next to that is the at birth in the girl oogenesis is arrested at the diplotin stage and prophase first meiotic division. Let me to describe the start with the oogenesis. Oogenesis start with the primordial follicle. Primordial follicles start in the intrauterine life from the yolk sac, and after that it migrate to genital ridge, and after that it converted into the primordial follicles, and after that it started the first meiotic division, and the first meiotic division, and in first meiotic division start with the prophase, and it when this is the primordial follicle, and primordial follicle, after that primordial follicle is converted, many primordial follicles go rapid division, and rapid division there is flat epithelial lining cell which are from the ovarian endothelial cell, ovarian epithelial cell, and then it converted to the primary follicle, and it get bigger in the size, that means bigger in size, and there is conversion of the flat epithelial cell to the cuboidal cell. This is the cuboidal cell, and this start the division, and it is under the process of the meiotic division first, and get arrested in the diplotin stage. Next is the What is the content of mesorectal fascia? The mesorectal fascia, their content is the superior rectal vein, pararectal nodes, and the inferior mesenteric plexus. But here the spare is the inferior rectal vein and inferior rectal artery. Next is the muscles attached to the greater tuberosity. The greater tuberosity of the humerus. In that, the greater tuberosity includes, if you look at this image, this is the greater tuberosity of the humerus, and there is connection of the supraspinatus, infraspinatus, and next image showing you that it is the supraspinatus which passes under the acromion process attached to the greater tuberosity of the humerus, and another one, the inferior to spine of the spinatus process of the scapula, is the infraspinatus. Due to inferior to the spinatus process of the scapula, so it is infra, and superior to that is known as supraspinatus. So here at the greater tuberosity, three muscles attached are supraspinatus, infraspinatus, and next to that is teres minor. Three muscles attached to that. Next one is the card test. Card test is done for the palmar introsi. The card test done is if you assume that this is the finger and this hand, it is the greater, it is thumb, and here this is the card inserted in that and get trapped, and the force apply to pull up the card. This is the test of palmar introsi. Palmar introsi, which are supplied by the ulnar nerve. So this is the test of ulnar nerve. Next one, that is the most important blood supply to the stomach. The important blood supply to the stomach is the left gastric artery. Left gastric artery at the celiac trunk. This is the celiac trunk where three arteries arises. First to that is the left gastric artery. Another one is the splenic artery. This is the left gastric artery, the splenic artery, and another one is the hepatic proper artery. Three branches from the celiac trunks, and in that the left gastric artery is the major artery which supplied the stomach. Next is the dynamic stability of the shoulder joint. Term is used for the rotator cuff. The rotator cuff, how can you remember the rotator cuff? This is very important. Many times asked in the NEET PG that rotator cuff. Rotator cuff this is the cuff which are formed by the scapula. In that scapula, the acromion process, coracoid process, and lower to that in the scapula is the glenoid cavity. In the glenoid cavity, the head of the humerus is fitted in such that stability is performed by the muscles which are the supraspinatus, infraspinatus, teres minor, and another one muscles is the subscapularis. This is the subscapularis. So you have to remember three muscles which support the rotator cuff is subscapular, infraspinatus, supraspinatus, and next is the teres minor. And sometimes the subscapularis is missing in that. This is also asked. Next to that is most abundant collagen present in the basement membrane is the type 4 collagen. The question arises that the type 1 collagen found in the 1 is written like ONE. Okay, so you can easily remember that BONE, 1 in both. So collagen first in found in the bone and collagen 4 in the basement membrane. Next, type 2, this is found in the like hyaline cartilage, other cartilage, but here bone and the fibrous cartilage are included under the type 1 collagen fiber are present in the bone and fibrous cartilage, and type 2 are in the hyaline cartilage and elastic cartilage. Next to that is the true about durameter. It is the outermost layer of the cranial meninges. It has two layers, endosteal layer and the meningeal layer, and it is supplied by the branch of fifth cranial nerve. The meninges in the brain, if make a image here you can assume that this is the medial most, that crista galli, and this is the division you can easily remember that the outermost layer is the durameter, after that arachnoid, after that pyometer, after that brain parenchyma. Outermost is the durameter. If you know Hindi, then darwaza is outer part, so it is the durameter. In the brain meningeal layer, the outermost layer, one layer is inner layer, one is outer layer. Outer layer is attached to the bone and known as endosteal layer or osseous layer. So it is attached to the bony part, and another one is the meningeal part. So it is divided into two parts. The true thing is that durameter is outer part and supplied by fifth cranial nerve. The structure seen in cavernous sinus. The structure regarding the cavernous sinus is, the first of all, the cavernous sinus is situated in this is the sella turcica, the part of the sella turcica. Around that this is the part of the cavernous sinus. It is anterior connection and it is posterior connection. In that, the arise is internal carotid artery. Next image showing you that this is the cavernous sinus part and it is sella turcica, in that situated pituitary gland, and in both sides these are the arrangement of the nerve. And here one thing you have to remember, this is the internal carotid artery, and in the internal carotid artery along with there is abducent nerve, and in the antero-posterior direction there is third cranial nerve, then third, fourth, fifth, first division of fifth and second division of fifth. This is the trick to remember, that third, fourth, fifth and sixth. This is very easy topic, so you can easily remember it by the trick. Next is the medulla receive its blood supply from anterior spinal artery and vertebral artery, and then pica, posterior inferior cerebellar artery. And next is the structure not passing through the foramen ovale. Foramen ovale, in the foramen ovale, male is the trick that passes through foramen ovale. M4 mandibular nerve, accessory this is emissary vein, laser petrosal, and to that is the gland, the foramen, showing you that here it is the foramen ovale, in that passing of mandibular nerve, not maxillary nerve, and here the foramen is foramen rotundum, in that maxillary nerve passes through that. Next is the important thing is the appendices epiploica, absent in. This is cecum, appendix and the rectum. This is absent in cecum, appendix and rectum. Trick for remember is CAR, C-A-R. The function of eighth cranial nerve is balancing and hearing. D2. It is also known as vestibulocochlear nerve, and vestibule is for the balancing and cochlea for the hearing. The pain insensitive structure in the brain is the choroid plexus. Independent assortment of the chromosome occurs in which stage of spermatogenesis? In that is the primary spermatocyte. When converted into the secondary spermatocyte, there is independent assortment of the chromosomes takes place. Next is the aortic hiatus contains aorta, azygous vein and thoracic duct. This is many times asked, that aortic hiatus, about the level of aortic hiatus, which structure passing through the aortic hiatus or content. So aortic hiatus, the level of aortic hiatus is T12. Next is the structure attaining adult size before birth is the ear ossicles. Next is the permanent mucosal fold R. The permanent mucosal fold is a spiral valve of Hister, plica semilunaris and transverse rector fold. Next is, in case of chest pain with pericarditis and the pericardial effusion, pain is referred by. This is by the phrenic nerve. The anterior ethmoidal nerve supplies interior of the nasal cavity, dural sheath of the anterior cranial fossa and ethmoidal ear cell. Next is microvilli is the microvilli present in the duodenum, jejunum, ileum, gallbladder and the PCT. So in the PCT it is known as brush border. The true about sphincter urethrae. Sphincter urethrae, it is under voluntary control. It lies within the urethra and it's supplied by pudendal nerve. Next, in median nerve injury at wrist, there is loss of function of. So, loss of function of which structure which supply median nerve, and median nerve supply the lumbricals muscles to the index finger, lumbricals muscles to middle finger and muscles of the thenar eminence. Next, regular nerve, artery and vein arrangement not present in the intercostal space is the first intercostal space. A patient present with numbness in little and ring finger along with atrophy of hypothenar eminence. Nerve injured is the ulnar nerve before it's divided into superficial and the deep branch. Due to the question is given that numbness in the little finger and ring finger along with atrophy. Here numbness is given and hypothenar is given, which are supplied by ulnar nerve. Membrana tectoria is the continuation of the posterior longitudinal ligament from the brain. When a spinal cord is the medulla oblongata is continue to becomes a spinal cord in the vertebra. In the brain, membrane is going through the posterior part of that, and which are posterior longitudinal ligament. Next is the Turkish saddles. Named space in the cranium is known to contain which cranial structure? It is the pituitary gland and the hypophysis cerebri. The Turkish saddle is named for the Sila turcica. Already told, the structure lies in that. The nucleus that lies deep to facial colliculus is the abducent nerve. Image showing you that this is the facial colliculus. This is facial colliculus. This cross-sectional diagram of the bones. So here it is the part abducent nerve, and this is the facial nerve which crosses it like that, but the just behind is abducent nerve. So correct answer regarding facial colliculus is the abducent nerve, not facial nerve. Next is the most important thing. Let me to tell you that the structures derived from the ectoderm are hair follicles, sebaceous gland, mammary gland, and the epidermis. So next topic is the tensor tympani. Tensor tympani is supplied by trigeminal nerve. In the normal gallbladder, epithelium is lined by simple columnar with brush border. You can easily remember the epithelial lining of the GIT system. In the esophagus, there is lining of pseudo-stratified epithelium. After that, to anus and stomach, there is only one thing you have to remember, that columnar epithelial lining are present in that. The perforator connecting superficial vein to deep vein is the important thing, that at the ankle joint, at the ankle, mid calf and lower thigh is the answer. Thoracic duct receive tributaries from bilateral ascending trunk, bilateral descending trunk, thoracic duct itself, left upper intercostal duct, left subclavian trunk, and left jugular trunk. The next topic, if you talk about the portal venous system, it is whole system is valveless. The enophthalmos is due to palsy of orbitalis muscles, and prostatic urethra it is semilunar and transversely in the cross section. The extraocular muscles supplied by contralateral nucleus is the superior oblique. The trigeminal nerve supplied medial pterygoid, lateral pterygoid, tensor villi masseter temporalis, tensor tympani, mylohyoid or anterior belly of the digastric. In the most of the part, the trigeminal start with T, so pronunciation of T in the most of the muscles like pterygoid, tensor villi masseter temporalis, tensor tympani. Next is the following are the branch of external carotid artery. The external carotid artery, you have to remember whole branches, that lingual artery, posterior auricular artery, superior thyroid artery, facial artery, occipital artery, superficial temporal artery, maxillary artery, and ascending pharyngeal artery. Next, very hot topic, the about cranial nerve. The general visceral efferents are the 3rd, 7th, 9th and 10th cranial nerve are the general visceral efferent. The reticular fiber of the connective tissue are present in the bone marrow, lymph node and spleen, but it is absent in the thymus. The mesonephric tubule and a duct give rise to vas deferens, epididymis and paraoophoron. The external anal sphincter is supplied by the innervation of S2, S3 and S4 that are very important for you. The nerve root or dermatomes supplied the thumb and the index finger is the C6, C7. The facial nerve gives rise to secretomotor fibers are the lacrimal gland, submandibular gland, sublingual gland, palatal gland and the nasal gland, which are made up of dense collagen fiber is the ligament, tendon and aponeurosis. Mucosa associated lymphoid tissue known as MALT is maximally associated with ileum. Another topic is muscles spared by complete transection of the cranial part of the accessory nerve are the stylopharyngeus. Next, a 50-year-old female patient has undergone mastectomy for carcinoma of breast. After mastectomy, patient is not being able to extend, adduct and the internal rotate the arm. The nerve supply to which muscles damage is the Latissimus Dorsi. The difference between cervical and thoracic vertebra is the foramen transversarium. Let me to tell you that the differentiation, how can you differentiate cervical vertebra, thoracic vertebra and lumbar vertebra? The most important thing in the cervical vertebra, the presence of foramen transversarium, which are absent in the thoracic and lumbar vertebra, and the body of the cervical vertebra and are smaller with respect to thoracic vertebra, and the transverse process, also a smaller one, and here the bifid posterior spinous process are present. This is the spinous process. Another figure showing you foramen transversarium and bifid spinous process. Next, the structure passing through esophageal hiatus is the left gastric artery, left vagus nerve, and right vagus nerve and esophagus. This is very important topic. Esophageal hiatus, aortic hiatus, and caval hiatus. Thanks friends for watching my video. Have a nice day.